Today we are here to distribute 100 bikes to students in the Seventh-day Adventist Secondary School in Makali, Konike, Barina Chiefdom. It's as a result of Schools for Salon's gesture to helping people who are traveling from far away to cut their time of commute. So they'll be able to come to classes and they will not miss classes. They will be able to come in time and then they will continue to learn. And from here, we'll be going to Maforeka, Cafe Simira Chiefdom, where we'll also distribute 65 bikes to both students and teachers. And from Maforeka, I'll be going to Bonkolenken Chiefdom, where we'll be able also to distribute 86 bikes to teachers and students. All is the efforts of Schools for Salon to improve education in Sierra Leone.
Well, last year, academic year, it was a challenging for us. Most of our children coming from far distance, 2 or 3 miles off, some of them could not be able to complete the academic year simply because of the distance. But coming with this great gesture, it is a relief to the parents as well as to the children. Paying for their pupils every day, morning and evening, to and fro, it was a challenge for them.
So I'm glad when we picking them they for this list for the bike then, and then they pay transport again. So I'm so glad. The money I use for pay transport for me picking, I can do to other thing. Picking you can quick na school and return quick na us for go do other thing and for study.
In 2018, the government of Sierra Leone, by extension the Ministry of Education, implemented education that is free for all of the children. Yeah, so in this, there are a lot of children who have not been going to school because of the barrier of them paying school fees. But as it is now with education for free, in the 2023-2024 academic year, over 1 million children flocked into the classrooms in Sierra Leone. And with this one, we know it is going to serve for the overall achievements of students, particularly the girls who, during their commit time to school, they face serious of harassment and exploitation. But with the provision of this bike, it will help them to come to school and focus in their education.
Before this project getting to school, it was very challenging. I had to walk about 3 miles away, which was very tiring and time-consuming. Receiving this bike will make a huge difference in my ability to attend school. It will help me to arrive at school on time. It will give me the ability or energy to focus on my studies. It will also help to improve my overall experience at school. And it will also encourage me to promote my physical health by encouraging exercise. And I want to thank Schools for Salon for this wonderful opportunity.
I am from Benin village, about 4 miles away. Before this project, I have to walk long distance, which makes me to be tired. And this makes me to become at school very late. With this project, it makes me to be punctual at school as all the time. I won't walk far distance anymore.
Schools for Salon and other partners want to give thanks to them for this great opportunity given to this school. We have been receiving a lot of assistance from this organization. We have been receiving school materials, books and chalks, which also help the school for us to get proper learning. They also help us to connect us with the library in Freetown. We also get material, books that we cannot afford to get within the community. Parents cannot have the sufficient money to purchase books, especially science books, for our pupils to use.
And the Schools for Salon has done a lot in this country. They've built several schools. They've built transportation, they've built schools. They've also trained teachers, which are the main challenges of the free education in Sierra Leone. And since they've done this, what they want to do now, they want to look at the situation wherein they can help children who are coming from far distance to, to school. And because with the provision of these bicycles, they will be able to come to school. They will not miss classroom instructions, and they will be able to attend school regularly.
Hello, thank you so much for joining us on today's Menstrual Hygiene Day webinar. My name is Vicky Rameau, and I am an advisor and board member at Schools for Leone, and I'm also a digital strategist and communications leader at VRNC Marketing. If you are tuning in right now and you've joined us, welcome. Please let us know where you're checking in from. I'd like to see your city. Drop your city in the comments so we know where you are. Today is going to be a showcase of our work in Sierra Leone to expand not just access to education, but to keep girls in school. Schools for Salone works in Sierra Leone through 5 partners, and we've been there for 2 decades. We're celebrating 20 years this year of learning and partnership and collaboration to deliver quality education, specifically or especially in last mile communities. Today is World Menstrual Hygiene Day. And as many of you know, thousands of girls in rural and remote communities in Sierra Leone face challenges due to the lack of affordable menstrual products and cultural taboos surrounding menstruation. This absence of products and silence around menstruation leads to missed school days, feelings of shame, and often the use of unhygienic materials, posing serious health risks. But this problem isn't just a Sierra Leonean problem. Globally, an estimated 500 million women and girls lack access to menstrual products and adequate facilities. However, in Sierra Leone, we're proud and excited to say that we've been able to move the needle forward. Thanks to a partnership between Schools for Salone and Women Talk, we have been able to manufacture locally in Sierra Leone 50,000 reusable pads and provided sexual and reproductive health education to over 25,000 boys and girls across various communities in Sierra Leone. And yes, you heard right, boys and girls. So one of the lessons that we learned while working in Sierra Leone to restore period dignity is that in order to help girls better manage their periods, we also needed to teach boys and men in communities about menstruation. We don't just talk to boys about girls, we also talk to them about the different changes that are happening in their own bodies, because we know that when boys and girls are empowered with the sexual and reproductive health education they need, it lasts them throughout adulthood. It improves their quality of life. But most importantly for girls, when they get the pads and the education, it helps them stay in school. And in many, many cases, it empowers them to be able to protect themselves against some of the dangers that exist in communities for girls that could lead to teenage pregnancy or early child marriage. So again, if you're here joining us for this conversation, we're really excited to have you here. This is a really important conversation and we want to hear from you. So feel free throughout this conversation to chime in. Joining me today will be several experts, like I said, in Sierra Leone and beyond, who are going to share their stories working as frontline workers in Sierra Leone and beyond providing reproductive health education and restoring dignity with menstrual hygiene kits. Like I said, Schools for Siloam has been in Sierra Leone for over 2 decades. When we started working in Sierra Leone 20 years ago, we were just trying to respond to the immediate need in the post-war period, which is that a lot of schools had been burned down in many communities, and they needed to be rebuilt. And that's how we got started. But in doing this work, we've learned that strengthening the ecosystem to deliver quality education is more than just about building schools. It's about training teachers and so much more. So for today, I'm going to introduce you to Women Talk. We're going to talk to you about period poverty in the world and in Sierra Leone specifically. And then we're going to share with you our approach in Sierra Leone to tackling issues that have to do with period poverty and lack of access to menstrual hygiene products. If we're about 12 minutes in, so I think most of the people who are here probably also know me very well. But if you're new, if for whatever reason you're scrolling on your social media and you're just coming across my face, I wanted to make sure I introduce myself. My name is Vicky Rameau, and I'm a Sierra Leonean journalist, civios, and podcast producer, amongst many, 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 many other things. I'm PR and communications and digital strategist. I'm a board member of Schools for Siloam. And yes, I also write children's books. So I'm excited to be here with you today. But back to Schools for Siloam. So we work through 4 major pillars. We work on access, which is, like I said earlier, building schools in last mile communities. What we've realized is that the distribution of schools varies by location, but also by type. Some communities have a primary school. Some communities have a primary school and a JSS, or a primary school, no JSS. Some communities have all 3. Some communities only have a senior secondary school. So what we find ourselves doing as we respond to the needs of communities in last mile communities in Sierra Leone is filling the gap. So if we're in a community and we know that they have a primary school and the community makes a request to us to build a JSS, we do that because we know that when children have access to the next level, right? If you have access to a JSS, it's less likely that you're going to drop out and continue with your education. Or if you don't have access to a senior secondary school and you're in JSS and you complete JSS, maybe your school, the next available senior secondary school is in a neighboring town. Maybe it's 5 miles away. Maybe it's eight miles away. The distance can oftentimes lead to dropouts. So we would go in and build schools. The other thing that we work on specifically is quality education, because we've learned that, yes, building the schools, fantastic. However, if you don't have trained teachers and the teachers don't have the resources to teach, they can't deliver quality education in the classrooms that we build. So we work through partners like the Learning Foundation. We work through partners like Program for Children to support teachers with teacher training, make sure they get certified through the Ministry of Education, and to also make sure they have learning materials, books, and tools to teach. We also work on literacy because we know that when we measure and we look at learning outcomes in Sierra Leone, oftentimes we find that numeracy and literacy schools are falling behind. So through partners like the Sierra Leone Book Trust and the Learning Foundation, we also support and equip libraries. We build libraries. We built 3 libraries in Sierra Leone. We also train teachers as librarian assistants and librarians so that they can bring the culture of reading and learn and support the culture of reading within their schools. A new project that Salbot recently piloted, and when I say recently, I mean like maybe a year or 2 ago, is we call them our cupboards of hope. So in schools that don't have big libraries, we install these smaller cupboards that have children's books and picture books in communities where for the first time children can have their own books to take home and bring back. And schools are actually setting aside a couple hours a week so the kids can read for fun beyond just like their textbooks. Lastly, we work on equity, which is where today's conversation falls. We know that education across the world, especially in Sierra Leone, is a gendered experience. If you're a boy and a girl, the kind of access or the kind of quality of education or the things that affect you um, vary, right? We know that girls in Sierra Leone have their periods, but we also know that a lot of girls in Sierra Leone don't have access to running water to manage their periods effectively. They don't have access to reproductive health education to make sure that they understand why and how their bodies are changing. And most importantly, a lot of families can't afford to buy pads. Every single month. Can you imagine a family that's earning less than $2 a day that has up to three girls or three daughters and a mom and a sister and an auntie in the family? You can't really provide for everyone's reproductive health needs. And that's where we come in. We've been able to find a way through Women Talk to manufacture pads in Sierra Leone in Freetown, thanks to a partnership with Days for Girls International, and they'll be on shortly to talk about their work across the world. And we women in Sierra Leone are producing these reusable pads. These pads last for up to 4 years, and I'll show you a video really shortly that shows the pads being made. And thanks to the funds that we raise at Women Talk, at the 47 schools that we've built and that we support, the girls in all of these schools can get these kits for free. And then most recently last year, because we learned that girls are needing to share their kids with family members, we were able to secure funding to be able to expand the support to give free pads, not just to the girls in our schools, but to the female members in their families as well. We've also been able to expand the reproductive health education beyond the schools into communities, because at the end of the day, this information is vital, not just for young girls who are going into adolescence, but for everybody. We know that there are cultural taboos and perceptions that affect the way people think about menstruation, reproduction, etc. And the information isn't always accurate or scientific or just readily available. Again, thank you so much for joining us. And all of our partners aren't here today, but the work that we do at Schools for Salone certainly would not be possible without all of our partners, Program for Children, Women Talk, Sierra Leone Book Trust. We also work with the Learning Foundation. We have a partner up in Kabbalah called Clinton Cocker, who helps us get this work done. I know I'm running through this really quickly, but we have a lot to get through today. Again, if you're just joining us, thank you so much for tuning in for today's conversation, Paths to Progress, Expanding Access to Education to Girls in Sierra Leone, brought to you by Women Talk and Schools for Salone. So yeah, that's it. So next up, I'm going to share with you a video that tells the Women Talk story in full. Women Talk is now a fully fledged NGO in Sierra Leone that's been around for 5 years. And it came together as a direct response to the increase in teenage pregnancy and just all the things that we learned in that post-Ebola period in Sierra Leone. But I'll let Juliet, our executive director at Women Talk, tell you all about it.
Partner with Schools for Salone USA.
Let me start that over.
Women Talk, it originates from Program for Children Sierra Leone. Program for Children partner with Schools for Salone USA. And Schools for Salone build schools with Program for Children. So after the Ebola session, the schools where Schools for Salone deal with Program for Children, we find out say Boku Pikin then drop out of school. So we investigate the reason why this happened. We see say girl Pikin they're not able to understand who that them be, and especially the importance of menstruation. And when they day at the period, they no get wetin dem dey use wey dem dey continue for go school. So with this investigation wey we do, we been get for reports to schools for Salone about that, because pikin dem no dey able for go school when dem dey na dem period, because dem no get wetin dem dey use. And because of that, boku dey drop out of school, and some pikin dem no dey able for do well na school because dem dey miss days for go school. Pikin some dey miss for 3 days, others 4, others 7 days, and you find out say all the days dem no dey able for go school. And when examination can come, they no dey able for do well. And because of the challenges of puberty, they don't understand how their body they work, and the urges of puberty, then they go astray. Some, they become pregnant and then drop out of school. And also the parents, because they don't understand, then they feel shame for talk to them, picking them about growing up. So that caused the picking them where then they go astray. So we report this to we partners when our Schools for Salone USA. Schools for Salone partner with another organization when our Days for Girls International. Days for Girls International gets a very nice curriculum on sexual reproductive health education. And they get a patent design when at the Days for Girls reusable menstrual pads. So we get the first person where come up from the US and when a chapter of Days for Girls named Dorcas. Dorcas come and gets the first sexual reproductive health education session with me, and come with kids from the US. So we start for going at the schools then, give the education, and then we give the parts to the of-age girls. So when we give the education, we start for give the education from age 9, because we want for catch the picking them when they're young. We want for make them know waiting they expect as then they grow up, and how we're able to tackle the challenges of puberty. So we give them education now. And from 2016, when we start this education, until 2019, all the schools then, where Schools for Salone get, at that time they have over 20 schools. We find out, say, we not get no picking where drop out of school because of teenage pregnancy or early marriage, because we even give the education so the parents for make them able for talk to them picking them. They're not for feel shy for talk to them picking them about growing up. So in 2020, because of the growth of the need of the kids then, by other organizations, other schools, people then come, they ask for we part them in the education. So we start for make kids where we they give to other schools them or other partners them at cost recovery. So 2020, we decided say woman talk for come out from program for children and for make it will be an independent entity, so that we go able for grow and reach more women, more girls, more people. So in 2020, Woman Talk became an NGO, a separate entity. A great impact done day from the time we start to girl picking them, woman them, boy picking them, and even man them. Because with the give this education, we they create awareness of growing up. We they help the pikin them for make them go able for cope with the challenges of growing up.
Well, them picking there, now picking the way they don't experience different form of abuse. We get some picking the way they don't abuse sexually. Then we get some picking the way they don't experience trafficking. Then we get some picking the way also they don't experience physical abuse. We also get picking the way now commercial sex workers them. Now then dinner, and most of them picking there, some of them they can go get them in the streets, while some of them the police they can refer them to we, and some of them now concerned citizens they can send them to we. We partner with Women Talk so that they go able for come and can teach them picking them more, even though they don't get knowledge on their sexual reproductive life. But we partner with them because we want for let them get more knowledge and also how for use the pad so that we able for help them for let them able for realize them sexual life and rights. Well, Don Bosco be done they teach the picking them on the reproductive health through the workshops the way the nurses them be done they get for them. And most of them picking their way don't reach that age where they don't begin to experience their reproductive life. Most times we can get a weekly or monthly workshop where the nurses them because we get clinic now. So the nurses they can get workshop with them, picking them and talk to them so that they will able for realize themselves. And at times again where we can bring them come back to the clinic, if the nurses then see say need they for let them educate them more, they can do that. Especially for the one the way something at them first time then where they can only experience some of them signs and they.
For Don Bosco na the first time this what they do but na me office na me own cadre dande na me own professional area dande for give health message and sexual reproductive health education so people and way they come and buy the kits. So as any time we are ready for give the education, and even we office we get people that we partner with where they call schools for salon. We get schools then various parts of the world, where various parts of the country, where every time we they go and give the education. So not only first time this for give the sexual reproductive health education, and also the first time this for give kids to girl picking them. Well, for the health talk, we talk about puberty, and we talk about why the importance of menstruation. Well, we take and say in any environment where we want to make that environment the sweet and get a success, both gender not for left out. So what in the man then gets, the woman then therefore know the ideas. And this puberty what we talk about, only targets the girl picking them no more. Because even some boy picking them, themselves they undergo some changes, then will be if girl picking see them changes, then they laugh the boy picking the way themselves will make them feel shame and leave school. And we want for make we get a wall of equality. So now that make we they also include the boys then at the education. Why we think say these kids the Don Bosco girl picking they need them now because we they cater for vulnerable girl picking they we're not able to get money for buy kits, for buy the disposable menstrual hygiene kits. So we think can fit say Don Bosco then are one of the people there way for benefit out of this program because we want for really upgrade them and maintain them so that they know they continue for go and misuse them for make them get what they want for, especially for maintain themselves whenever then they on their messes. And inside there we able to tell the pikin they say Motaman woman in average time where they see in period na 3,000 days. And we take them through puberty. And inside puberty, we able to know say puberty na the changes the way they happen. Where pikin they come up from pikin and go to big person. And inside they get some changes the way it they happen. And inside them changes then you get one way na about menstruation. And inside menstruation, because of the menstruation, pikin they don't know why they see them period. So we take them through and tell them say now because of period make Motaman them bokuna the wall. And we also talk about the important day for this day when the International Day of the Girl, where we dey try for talk about the girl pikin dem say today na dem own time, na dem own responsibility, na dem own right, and na dem own future. So the education, because we no dey able give the kids outside without the education on how for use am. So boku pikin dem no know the importance of why dem dey see dem period. So we take them through the importance of menstruation, because without menstruation, Motamano for don dey na the world. Sometimes na only 1 or 2 people away na the creation story wey na dem dey no more na the world. But because of menstruation, make day like today, the population increase.
So well, before the pikin dem bin don dey use pad wey we dey buy, and e very much expensive, because after they use am, dem get for dispose am, dem no get for use am again. But with this one wey woman talk dey provide for them, I believe say im very much fine for them, because after they use am, dem go get for wash am back and reuse am again. So it go be very helpful to them. And even after dem comot na here and go back na the various homes dem no get for go get money again for go buy. That one day dem go able for use am back and continuously dey use am.
Then kits there wey we dey distribute today, na one woman wey dey call Calista West. Na im buy them from Woman Talk, and Woman Talk na we dey make them kits there. It take about 15 minutes for make we complete, for make one set, because we get various components wetin dey inside the kits. We get 1 cotton bag, we get 8 liner, we get 2 panties, we get 2 shield, we get 2 bars of soap, we get 1 instruction card, we get 1 plastic ziplock wey we dey use am for storing the swell. And the swell means say na dem material the way e don use the period pad wey e dey use, e dey put am, you keep am the way you reach na you hose for make e book am. And we get 1 other plastic bag wey you dey use for store all the clean material and keep am for the next use.
Sorry, it's really hard to be the driver and the apprentice at the same time. So sometimes, I'm in the back end of the dashboard struggling to make things work. So yeah, those of us who are in Schools for Salone who do the work to support Women Talk are just incredibly proud and inspired by what they do day in, day out. Most of the women who work at Women Talk are themselves coming from very vulnerable backgrounds where this job ends up transforming their own lives, right? So they become agents of change in their communities and beyond. I've actually had the pleasure of going to the Women Talk factory in Freetown and connected with the women there. I've met Juliet, I've seen the women, and their kids are there. It's like daycare on site. It's just an incredible institution, and they are definitely at the forefront of Sierra Leone's local response to period poverty. I think one thing that's really important to understand about how or why these conditions exist, it's not just a question of people or families being too poor to provide the resources, right? This is a global issue where countries and governments, local and national, have not provided the resources, right? Because if we look at it, if it's a question of equity, all girls and women, a majority, experience their periods at some point in their lives. This is something that they do not have control over. And so I feel like understanding the issue, it's less about families can't afford, it's more about society and communities not taking menstruation as something that we need to equip children and adolescents. Like everybody needs to kind of be all in on the campaign, the activities to empower girls and women. So in Uman Talk, their motto is Uman Talk not all man business. And yeah, I mean clearly you can see that like I live by that motto. It's really important that we understand that this isn't some side issue. It's a key issue in for quality of life and well-being of girls and women, especially girls who are of school-going age. Um, it always, I think about it all the time actively whenever I have my period, and you know the only thing I have to worry about is you know, oh, I have cramps here and there. I can't imagine a life where one has to also worry about, oh, I can't go to school today because I don't have pads, right? Or feeling shame about being on your period, or feeling like I have to remove myself and hide and disconnect from my community and my family and my friends because I don't have the tools. So that extra shame and stigma that girls have to deal with, especially when they're of school going age, it really is unnecessary, and we need to do our part to make sure that we can restore their dignity. There should be no shame or stigma around something as natural as getting your period. And the work that Uman Talk is doing in Sierra Leone is ensuring that girls in less mal communities especially know that their periods are a natural occurring part of their lives. They're going to schools and making sure boys know that, and families know that, in communities. And that's why we're really excited to be here today to share their story with you and to show you how far and how equipped they are to do this work when we provide them with the resources. At our core, Schools for Salon really is a philanthropic organization. Unlike a lot of international organizations that send, you know, teams to do development work, we work primarily and exclusively with local partners on the ground. When we learn about a need, our knee-jerk reaction isn't to, hey, let's send a team. No, it's to find local partners who are already championing this work or who can champion the work, mobilize the resources and funds for them to go into their communities and do program service delivery. So again, we are here talking about menstrual hygiene in Sierra Leone and providing pads, reusable pads. And the reason why I stress on the reusable is that we know that there are other programs in Sierra Leone where people distribute free pads. But the problem with that is, you know, when you give a girl a packet of a pad, it might last 1 month or 2 months. And then, you know, they don't have it and they still need more. The other issue is that when you give a girl a pad in a community that may not necessarily have running water, when she's in school and she uses that pad, the school may not have running water. So she can't actually manage her period in a way that is best for her. What makes the Days for Girls kits amazing, which is like it's a whole patented kit, and Diana will talk about that later. It has these inserts that can be, you know, put in like separate. You'll see it. It's like a little fold. It's like in the, you know, the wing that, you know, and you can remove the insert, put a new one in, and then put the one that you've soiled into that Ziploc bag until you can get home to a place where you can wash them. And the pads as they are, they can last up to 3 years, I believe, with good use. And when we give them in the schools that we work, we give them for free. And so that's why we really need your support to make sure that we can continue to do this work. Right now in Sierra Leone, we're just going into the rainy season. So Uman Talk is going to do the final reproductive health workshops. It's at our schools and communities. And I think this is really important because when when school closes and girls are at home, these are the times when they're most at risk for pregnancy. This is the time when, you know, they don't have the safety that school provides, right? So this is a time where it's really important for us to equip and empower girls with reproductive health education, especially as they're about to go on vacation. The support that you provide to us today makes sure also that when school opens in September, there's no lag for those girls who are coming into JSS or SS. There's no lag in the work that Women Talk will be able to do. They can hit the ground running if we mobilize the resources that we need today. Our goal for Menstrual Hygiene Day fundraiser, which is what we're doing now, is to raise $15,000 to support the production and manufacturing of kits, and also the reproductive health education sessions that we host in schools for boys, girls, and communities. So yeah, we're about to get, I wanted to show you these photos because I love them and my team took them. So these are some of the sessions that we host. I'm also going to play your video. This is an Women Talk reproductive health class with boys in a school in Makali. And this is a session with girls. So Women Talk separates the training. So girls have their own and boys have their own, but they're learning the same material. But, you know, it's just so much easier, more comfortable for us to do it separately. So everyone can ask the questions that they need to ask. Like I was saying earlier, we don't just distribute these pads to the students and the girls in the school. We also distribute them to their mothers or their aunties or the women in their lives to make sure that the girls don't have to share their kits when they get home, because we found that that's something that's happened. All our panelists seem to have joined the conversation now. We have a really, really great conversation set up for you. We're going to be talking to representatives from PIH, Days for Girls, Mama Peking Foundation, Women Talk, and of course, Allison Sinin, who's the executive director of Schools for Salon. Right before we get into the panel discussion, I want to show you our latest Women Talk pad distribution and reproductive health session, again in Makali. So if you joined us earlier in the conversation, we showed you bike distribution also in Makali. We went back to that same community to do reproductive health education and to distribute pads earlier in, actually this was last month in April.
Today, the Women Talk team is in Makali at the SDA Secondary School Makali community, giving sexual reproductive health education to the parents and their daughters in school. We get 2 fallopian tubes, we get 2 ovaries. And inside the ovaries, there are tiny eggs them. The eggs then so boku in a way that every month it will release one particular set of egg. Every school academic year, we pay 3 times visit to the schools. Each term, we pay a visit, and we have 4 sessions. 2 sessions one session for the parents, for women parents, male parents, and 1 session for school pupils, for girls, and 1 session for school boys. And why we need to continue coming to this school to do short education, because it creates an impact. It helps the girls and their mothers to know the importance of menstruation and why they should accept menstruation as a natural part of being in their life, because it helps them to realize that without menstruation, there will be no people on earth.
When I started seeing my period, my mother told me that it is a natural thing. I should not be afraid of it. And with the help of Women Talk, they also teach me that it is a natural thing. And I should use pad when I see my period. After using the pad, I should wash it clean.
The first step, the time I've been there in 12 years of age, where they start my period, where this they use pieces now they use. I be they double me a minika. Sunday I can wear then 3 to 4. From that, I work something when I tight, where I no go any side and public, where I go able disgrace. They give the cause where I can use. But since where this talk don't come, when I the woman talk, now I dey use the pad, I use only one knicker, and I use me tight.
One of the strongest misinformation that they do have, that when they are menstruating, they should not participate in preparing food. They should not participate in terms of worship. It's just because their parents did not have the correct information. And you can't give information that you don't have. You always give something that you have. That's why Woman Talk, with the help of Schools for Salone, we came up with this intervention so that we give them the correct information for them to have informed decision making towards their future.
But for making a born picking, there is something very responsible. What's responsible?
Most of these boys in this school, they are brothers and to these girls. And as a result of that, we teach them that when a girl is menstruating, it's a sign that she is maturing. And it is also a sign that she can give birth. As a result of that, they should respect a girl when she's menstruating. They should be caregiver and they should assist in other house chores at home. Because during that period, they experience pain and the normal things they used to do, they can't do it. So they, as brothers or friends, they can come in and help.
I learned about menstruation. This is the time when girls begin to notice changes on their body. And menstruation, this seems that girls will reproduce. And without menstruation, there is no reproduction.
At first, I was shy to talk about my period, but with the help of Human Talk, they teach us that it is a natural thing. We should ask our elders to teach me about period. The best part of today's training for Human Talk is to teach us how to wash our pad and how to clean them, wash them after using it, and keep them for the next using.
Thank you. So right now, I know that all of my guests are here, so we can start today's panel discussion. Let me bring everybody on. Okay, Diana, Juliet. I have to find everyone. Where is everyone? There they are. And Isata. Okay, great. Hello, ladies. Thank you. Welcome. Joining me today are some amazing women's leaders. Let me start off here. We have Isata Dumbuya, who is the Director of Maternal and Reproductive Health at Partners in Health Sierra Leone. She is a midwife with over two decades of experience, including extensive practice in the UK. After many years in the UK, she returned to Sierra Leone to help address the country's high maternal mortality rates. At Partners in Health, she has led efforts to strengthen maternal and neonatal care systems. She has led numerous training, built partnerships with government stakeholders and trust with traditional birth attendants, and supported development of the new Maternal Center of Excellence. She is a mother of 5. Ooh, girl, okay. With my one, I am struggling. So, amazing. She's a mother of 5 and a passionate advocate. Isata blends a global expertise with a deep understanding and engagement to create lasting change in maternal health care in Sierra Leone. Thank you so much for joining us, Isata.
Thank you, Vicky, and thanks everyone for having me. I'm really looking forward to this.
Welcome. Next up, I'd like to introduce you to Leanne Risk, who is the country director for the Mama Pekin Foundation. She is a public health professional with over a decade of experience in sexual and reproductive health education and advocacy. She's extremely passionate about adolescent women and families getting the reproductive health education that they need. Her experience spans across the US and Sierra Leone, including working in HIV prevention in Harlem and reproductive health mobilization with Planned Parenthood in the greater state of New York. Since 2021, she has served as the country director for Mama Pekin Foundation in Sierra Leone. She continues to drive maternal and child health initiatives. Leanne holds an MPH with a specialization in maternal and reproductive health from CUNY, New York, and she's also a proud first-generation Sierra Leonean American and a mother of two. Thank you so much for joining us, Leanne.
Thank you for having me. It's a pleasure to be here.
You're welcome. You've already seen her speak, but next up, I'd like to introduce Juliet Roman, who is the executive director of Woman Talk. Woman Talk is a woman-led organization supported by Schools for Salone, committed to ending period poverty and advancing menstrual health in Sierra Leone. Under her leadership, Woman Talk has produced and distributed over 50,000 reusable pads and provided reproductive health education to girls and boys in rural communities. Juliet's work centers on breaking the silence around menstruation, promoting dignity, and ensuring that no girl misses out on education because of her period. Her commitment continues to drive national conversation and menstrual health and gender equity. Welcome, Juliet. Oh, you're on mute, Juliet. You have to unmute yourself. Sorry.
Thank you, Vicky, for having me.
You're welcome. Thank you so much for joining us today. Next up, I'd like to introduce you to Diana Nelson, who is the Global Advocacy Director at Days for Girls International, where she leads global efforts to advance menstrual health policy, education, and access. Her work spans menstrual product standards, supply chains, and advocacy for period positive workplaces. Diana has helped shape key initiatives, including South Africa's reusable menstrual product standards and the launch of the SA Menstrual Health Coalition. She also co-chairs the Menstrual Health Supplies Workstream for the Reproductive Health Supplies Coalition and holds leadership roles with the Global Menstrual Collective and the African Coalition for Menstrual Health. Diana holds a master's in TESOL and a bachelor's in communication with a minor in sociology. Thank you so much for joining us today, Diana.
Hi, thank you. I'm thrilled to be here.
Last but definitely not least is Allison Sinning, our executive director at Schools for Salone. She served in the Peace Corps and taught in Sierra Leone from 2010 to 2012. I believe she was at the great Hafford School for Girls in Moyamba District. She has experience working with NGOs and social services such as Peace Corps Liberia, Lutheran Social Services of SD, EMBE, and now with SFS. Allison is passionate about education, civil rights, and social action. Welcome, Allison, and thank you, ladies. I know that was a mouthful. Everybody's like, "Oh, that's a lot." But thank you so much for making the time. Kicking off the conversation today, I want to start with, Diana and Leanne. What are some of the key challenges? Diana, you can go first. What are the key challenges that girls face globally regarding access to menstrual products and reproductive health education? And can you compare maybe some of the differences between what happens in OECD countries versus the global South?
Sure. Thank you for that question. And thank you for this great webinar. I love seeing Juliet succeed and all the impact that she's having. I mean, 50,000 people reached with access to products is amazing. And I love that she's bringing the men and boys into the conversation. So, this is a global problem, as you know. Just to put some numbers to it, there's 2.2 billion people in the world that are of reproductive who are going through reproductive health, issues. And of those, 500 million on a given day wake up not having access to products or understanding what a period is. And so just to put that into perspective, that is the entire population of Mexico, the United States, and Canada. And one of the things about period poverty is it really knows no boundaries. It happens in every country. It might just be more prevalent in others, but we know, for example, in the UK, 1 in 10 people are challenged to get access to products. In the United States, 1 in 4 recently said that they have a hard time accessing products, and that's no different in Sierra Leone. In fact, there's many things beyond just the product, right? It's access to the product. It's access to understanding what menstruation is, and that's why I love that Juliet's work really combines providing access to a product along with access to information. It's important that everyone understands what that is. And in Sierra Leone is no different. Like, one of the challenges in Sierra Leone is 14% of the schools there actually have ways for girls to manage their soiled products, which I think is a really great answer to what Juliet's doing, because she uses a reusable product. That is not a challenge for those who are using her products. They can use it for years and years and not have to worry every day, where do I put my soiled product, because they know that they just wash it, because access to proper disposal is such a challenge. And so I think, again, just the work that she does is so important, and it not only from a health perspective, when people have access to a health and a healthy hygienic product, that keeps them healthy. It keeps them at school. It keeps them at work. I'll stop there because I think Leanne can probably touch on so many more things, but it really is a universal issue that hits everywhere. I think we just see it more in other countries, and Juliet is doing a fantastic work at meeting that need. But Leanne, over to you.
Thank you, Diana. And I think just to pick up, where you left off, I think obviously, yes, it is a global issue. It's a global struggle for many of our sisters around the globe, including developed nations. And I think one thing that is important to note when it comes to when we're talking about Sierra Leone specifically, and a lot of other West African nations or developing or LMICs that we like to call it in public health. But I think here there's like a cultural aspect to it as well. And I think it's important to understand that. And that's the reason why I feel like, Madam Juliet is doing an amazing job, because she can actually really hone into that cultural aspect of things. And I think it's really important to shed light on that, because I think people are really protective of their cultural space. It's always something that I think people from the outside might come in and say, oh, this is wrong, like FGM is an example, and other practices that kind of go along with some of the things that we might see as a global, issue and a global oppressive practice against women and girls. And yes, it is. But at the same time, we have to have that cultural sensitivity around why these people think that this is appropriate, and why are we not talking about menstruation? Why aren't we talking about sex and sexuality? Why aren't we talking about the importance of knowing your body parts, especially like body parts like the clitoris, and I just came off of a whole tangent talking about the clitoris because it was recently International Clitoris Day, and I think almost everyone that I spoke to was just shocked, that I was even saying it in Sierra Leone. But these are the things, because it's a culturally taboo, no-go area, but yet we have everyone struggling with it in silence. And it's just one of those things that someone has to say it, but how you say it, when you say it, who you say it to is the cultural piece. And that's very, very important. So I think, besides the statistics, besides the fact that, yes, period poverty is an issue and reusable pads are the way to go, especially in Sierra Leone, I think that outside of that, there's so many issues tied to the cultural side. and we have to be cognizant of that. So I think that that's really one of the parts that, you know, we are working towards, and I'm glad that Umantak is doing a great job doing that. Yeah.
Thank you, Leanne. I feel like one thing you can know about Leanne as a public health advocate, you will not engage in conversation with Leanne without hearing the word clitoris. You will hear, like, she will leave no conversation unturned. I mean, I love it. So every time, just like, yep, Leanne, just waiting for you to drop it. So thank you for always making sure that there's a clitoris in the room and in the conversation.
You're welcome, girl. I'm here for you.
So, moving the conversation along, Isata, I know that you have, you know, extensive experience, not just in Sierra Leone, but in the UK. But tell me about some of the key challenges that girls and women face regarding access to reproductive health education, right, in these last mile communities or rural areas. What's stopping? Well, I guess not stopping, but what are the barriers that make it so that a girl doesn't know her body parts, right? What do you see as, like, a clinician or a practitioner, maybe with girls and women?
So within that sphere, even in this age, we still have young girls and what you would term as adult women not really being able to know and recognize their sexual and reproductive organs, not being able to talk about it, not being able to even acknowledge that these things exist or have any bearings whatsoever on their sexual and reproductive health. So I couldn't stop laughing hearing Leanne talk about clitoris. I'm like, okay, that's a conversation by itself that can open up a whole different kind of worms, because you have because we do a lot of work with adolescents and youth. And you would struggle to find a number of them that would be able to name that particular part as an organ of sexual and reproductive health. FGM issues aside, even for the ones that haven't undergone FGM within Sierra Leone, would not really understand or know the importance of that within sexual and reproductive health. And the same goes for women who themselves, because we see a lot of pregnant women or women wanting to get pregnant that don't understand about the full functioning about sexual organs and stuff that some of us will really take for granted. And these are things that are not discussed. They're not talked about. You still have young girls sort of in school and suddenly start their periods, but no one has ever told them this is what you have to expect. This is a natural progression. This is what will happen to you at some point as you grow into maturity, and this is what you're to expect, let alone that this is how you're supposed to handle that. So they come away frightened, they come away not expecting what is going on. And increasingly in this day and age, you have girls as young as 8 years old and 9 years old who have already started their periods, but don't even understand what this is about. So you'll have parents who would tell you, I was waiting for her to start having breasts before we have this conversation. But breasts and having a period don't necessarily interlinked. That you could have that without, you could have start your periods without having breasts, but you haven't spoken to your child. Your young daughter doesn't know or expect anything like this, so she's caught unaware. She doesn't know how to handle it. We've had cases of a few who have come to our adolescence clinic with their soiled underwear and telling you, I don't know what happened. I fell down and I think I might have hurt myself. So you have to carry on unpackaging these things before you can even realize that actually this is just a young girl who has started her periods, but nobody knows. She doesn't know what's happening. You call the parents in and they're arguing, oh no, this cannot be the case because she's too young, but she's too young. And by saying that, as if they're going to reverse the whole process, and like she might look too young, but this is nature. In these days, you're not waiting till girls do not get up to 15 and 16 before they start having periods. They're starting much younger. Are they prepared for this? No, they're not. Are their parents themselves prepared for this? No, they're not. Do they have a proper understanding of what that means for your entire body, for your entire sexuality and reproductive health? No, they are not. Who is to have these conversations with them? Their parents are, but their parents themselves can only have these conversations if they understand it themselves and if they feel comfortable with themselves. We still have a lot of religious and cultural taboos that say, "Oh, you shouldn't talk about these things." We go to schools in our adolescents and youth clubs, and before going in, we have to have a lot of engagement with parents clubs. We have to have a lot of engagement with religious leaders and with cultural leaders as well to say that we're not going to these schools to go and talk to young people that about having sex, but we're talking to them about to have more knowledge about their bodies, have more knowledge about their reproductive health, and therefore through that they can have more say about what they want to do, what they can do, and what they should do. But if you don't even know anything at all, you could be pregnant and then they'll turn around and say, I don't know how it happened. And they're not lying because nobody has told them this is how you get pregnant. And this is what you're to do if you don't want to get pregnant. And this is where you can come to access that information. So it's really important for us as people within this field to carry on these conversations to not just the children themselves, but to actually, in some many cases, start with the parents because they are the ones that really, if we empower them more and get them to understand more, hopefully they can trickle down these messages to the children at a much earlier age as well. I'll rest there and
No,
hopefully we carry on with this conversation.
no, thank you
Thank
so
you.
much. Juliet, as you've been doing this work now for a little over 5 years. What are some of the things that parents tell you about their fears and concerns about their daughters finding out about their bodies or learning about their reproductive health? What are parents in Sierra Leone, in the communities where you work, afraid of or say they're afraid of?
In many rural and remote parts of Sierra Leone, the parents and only female parents face a lot of challenges. And one of the things that parents usually talk about helping their children in school or helping their children for menstruation is the limited access or high cost of menstrual products that are available because sanitary pads are.
I'm not going to ask which phone network she has. So I don't get in trouble. Oh, there you go. Hello, Juliet. You're back on. We can see you.
Hello?
Yes, you were just talking about what the parents, what mothers were telling you about the high cost of sanitary products. Please go ahead.
Yes. So they talk about the high cost of sanitary pads, and that because of that, a lot of them can't afford it. And that's why individuals can purchase unnecessary supplies because the risk that are on those parts don't let them to purchase these parts. So because of that, a lot of them don't go to school. And they said their children miss school. And even the mothers, the parents, they also miss work and also talk on the stigma that surround it. So individual may use unsafe and uncomfortable alternatives like rags and papers. In fact, at one time in one of the villages, the girl was just 9 years. So she was in her period.
she started seeing her period at age 9. She told her mother, but the mother didn't believe what the girl said. So because of this, the girl don't have words to use. She decided to tear papers from her books and stuff it on herself. So when I was there, the girl, after the session, says this to me. I met with the parents. The mother told me that she is sorry. She was not thinking that the girl was saying the reality. And that beside that, she don't have something to give to her. Even for herself, she struggled with using rags. So that's one thing that they are really complaining of. And also, they talk of the limited knowledge that they have on this matter, on this topic on menstruation. So many girls and women, they lack the knowledge about menstrual hygiene and the importance of proper management due to the silence of the female reproductive health. Parents don't understand, and because they don't understand about menstruation, they can't deliver the right message to their children. So because of that, children usually manage themselves in a way that is unhealthy. And at times, the information about menstruation is passed from mothers, friends, sisters, and aunties. But then they mixed up this information. They mix them up with cultural beliefs like superstition, practical information that is sometimes helpful and sometimes they are not helpful. So many of them don't talk the reality about menstruation because it is being linked to sexuality. So they find it difficult to talk to their children about it. So this make the children most times feel very uncomfortable and feel like, in fact, dying or not going to school or going to anything because they can't get the right information. And the problem here is that the parents too don't have the right information. So how can they tell this information to their children? So the stigma and also surrounding menstruation also is a problem at homes and communities because it is difficult for these girls to ask questions to get help. And the stigma of it, makes parents don't have the feeling or the chance to explain this to their children. And this causes screening and discrimination. So girls get blood on their cloth for the first time are teased by teachers, boys, or other girls. And this make the parents feel bad because when they go, the children explain to their parents about what's happened to them, especially when they mess up their uniform or their clothes. The children don't feel good. And what's normally, like I have a testimony, what the mother did. She just told her child not to go to school again since she has been shamed. So all those things made the children not to have the proper message on menstruation, and they can't handle themselves.
Thank you.
Cultural norms and practice also are other things, because even with the parents, these make them to feel shy, and they transferred this to their children, because most times they said their mother shouldn't cook when they are in their periods. They don't go to the rooms of their husband when they are in their periods. So all this, they don't go to worship centers, all these ones. The mother too are undergoing those things. So they can't explain to the children the right message, because they too feel it. So these all bring problems with menstruation.
Thank you, Juliet. Oh, sorry.
Menstrual rituals and ceremonies are.
Juliet, can I stop you for a second just so we can
Hello?
move the conversation? I'll come back to you. I'll come back to you. Thank you so much. It's so amazing to hear.
Okay.
You know, as a frontline, you're basically like a frontline worker, right? So it's so amazing to hear all of these anecdotes about what's happening in communities. And that's why I feel like this work is so important, because it's not just going to do the work, but it's also learning about, you know, how people are thinking about these problems, how they're dealing with these challenges, how they're experiencing them, because then that helps informs the kind of programs that we can create and deliver to help ease these challenges. Leanne, tell me what Mama Pekin Foundation is doing, I guess maybe generally, maybe not specifically on period poverty, but just in, because I feel like reproductive health it's like it's a whole life thing, right? It's, you know, it's as soon as we come into this world, you know, we start a reproductive health journey. So tell me where you guys are in terms of like the entire providing care for girls and women's reproductive life as a whole, and what are some of the initiatives that you're working on right now to address some of these challenges?
Thank you for that question. Yes, and I do agree. I have this phrase.
You know, you've educated me a lot, so I have the language right.
You know, I have this phrase that I typically use as like, we're sexual beings from the womb to the tomb. So when I say that, it's an entire life cycle thing. And this is the reason why I truly am so passionate about sexuality education, sexual and reproductive health education, however you want to coin it, because it is so critical to thriving in life in general. And so for me, I mean, I think it's right on up there with the calculuses, the further maths, and you know the the physics and the chemistry. But obviously, it's a constant battle to make sure that people understand that and accept that in many societies. But I digress. I'm going to go back to Mama Pekin's question. So the Mama Pekin Foundation is an NGO, a local indigenous NGO operating in Sierra Leone. And it was founded by two Sierra Leonean doctors, an OBGYN and a pediatrician, hence the name Mama Pekin, mother and child. And so that they founded it back in 2008. And the doctors is Dr. Fatou Forna and Dr. Sheku Sise, who happen to be married, their husband and wife as well. And so they came together, they saw the need, they're also working in this field directly, and they definitely wanted to find a way to give back. So our primary goal and mission as an organization is to improve the life and the health of women, children, and families in Sierra Leone. And we are really strong in areas that I think a lot of people don't think of when they think of, you know, NGOs that work in reproductive health space. I think a lot of people tend to think that it's always direct community level interventions, which we do have. But we also work we work very closely with the Ministry of Health, of course. And we also had the fortunate ability to be awarded a grant back in 2020 to implement the very first postgraduate training program in obstetrics, gynecology, and pediatrics in Sierra Leone, which is key to helping us improve maternal and child health, right? But that's from another lens, right? That's from capacity building. That's for making sure that we have homegrown specialists in the country, because what was happening prior to that was brain drain and people will leave and don't come back. And that was the case. We had less than 5 specialists in each discipline prior to the program. And now we're proud to say that we have 8 OBGYNs that we just graduated, who are the very first cohort of OBGYNs trained in Sierra Leone, and we're very proud of them. And then we also have about 7 pediatricians that have also gone through the program. And that has been a huge, huge blessing. We're so happy and proud of these young doctors who are out there on the front lines and making sure that we have specialists in the country as we do need them. So that's one aspect. So we're really here for, to improve maternal and child health in different aspects. Capacity building is one. We also have education and direct community service level interventions. We have, the Leone Bateau group, which is basically working directly with pregnant women. It's like a pregnant woman support group. That would be the translation. And where we provide like a big cook session where the pregnant women come to ANC clinic and the nurses are there and all the staff, and we cook together local dishes, talk about the benefits of nutrition, the different nutritional benefits, and also take that time to talk about different health topics that are pertinent to them. And so these are things that we're doing. We've been doing since 2008. That's like our staple program. And we also have research that we have going on, including climate change research. There's a lot of climate change research out there proving that there's a huge impact when it comes to extreme heat and how extreme heat impacts the outcome of maternal health. And so in many ways, right, especially when we talk about pregnant women and birthing people. So these are all the things. In addition to that, I am a certified sexuality educator, so I will be talking about sex no matter what. And so these things, one thing I will say before I close is that I think we put a lot of emphasis, because we are in public health and we're trying to make sure we walk this really fine line about reproductive health. Reproductive health is a component that is important, but it is the component that really doesn't hold the weight, because the component is the sexuality piece that holds the weight. And people tend not to go on the sexuality piece because it is it's so controversial. And so I think for me, like I said, Vicky said it, I'll say clitoris anywhere, and I'll translate it in Creole for you, conch. And I will say that over and over if I need to, because at the end of the day, we need to understand that we are living this life and we need to feel good living this life. Things need to feel good. So we need to know what feels good and what does not feel good. How can you know that if you're not talking about it? Reproductive health doesn't talk about what feels good. It talks about how you can be pregnant or stop being pregnant. It talks about fertility. And so these are the things. So, I mean, these are important, but it shouldn't overshadow or outshadow the sexuality piece. And so even when we're talking about menstrual hygiene, it's important for us to let the girls know, let the boys know that, yes, this is an important part of puberty. You're feeling all these feelings. It is okay to feel that way. It's also okay to masturbate. It's also okay not to have sex. It's also okay to feel good without having sex. You should not feel ashamed if you feel good on your own. And so these are the things. So I just wanted to plug that in there just a little bit.
I know. Always know always know what's coming in. Thank you so much. Diana, so one of the things that we've noticed through there's a child that belongs to me that's calling me from West Africa to talk about a game, I'm sure. And I don't know. Sorry. Relentless. All this because of menstruation. All this. If not for menstruation, there'd be no child calling me right now. Diana, one of the things that we've noticed a lot in Sierra Leone is people do makeup pad workshops. Whether people just say, oh, we're going to teach girls how to make pads, right? and they cut up cloth. Sometimes they put plastic in this cloth and they say, oh, we've made a reusable pad, right? Please talk to me about the Days for Girls patented kit and how that was developed, what it does, the materials used, and the kind of dangers of making these like makeshift reusable pads as a poverty kind of like intervention.
Yeah, that's such a great question, and I'm kind of going to take it from a holistic viewpoint first. You know, one of the things, our number one, I think our number one focus when we want to provide access to a product is it safe, and is it reliable, and is it effective? And so and as you said, sometimes people, I think, well-intended. But they try to get people to say, look, pay us and we'll go teach people how to make a kit. And the problem with that is they aren't always using safe materials. Usually what they're teaching can only be used one time and not for a long time. And so we know one of the things that we're passionate about at Days for Girls is standards. In fact, I sit on the United States. I just was representing them as the head of delegation in Kenya at the ISO, it's called the TC338, which is, for the first time, it's kind of shocking, this has not happened, but there's a standard that is being made globally for menstrual products. And you know, we have standards for paper clips, for everything, but not menstrual products. Can you believe this? And so anyway, all that to say, globally, it is so important that we have a standard. And so these classes, where they're doing it, again, well-intended, but often not the most safe and absolutely not sustainable. So Days for Girls, the kits that Juliet is manufacturing have passed the standards in every country that has a standard, in South Africa, in Kenya, in Uganda, because we're very passionate about ensuring what is being distributed in our name with our patented product, is it safe and is it reliable? And so as Juliet is an enterprise of us, she gets our patterns, she gets access to our fabrics that all ensure that this is safe and effective and meets the needs of those that are using it. So that's why we're very passionate that that you just don't go out and teach people how to do it. Again, well-intended, but not sustainable, and many, many times not safe.
Thank you so much. I see you're no longer in transit. you don't reach your destination. Tell me about, first of all, yeah, I can see that. I'm a huge fan of PIH. You know, when I was in undergrad, one of the books that changed my life was Mountains Beyond Mountains, which was, you know, the biography of Paul Farmer. And it really opened my eyes to what one person committed and dedicated to one thing can do, both on the community, national, and global level. And it's part of the reason why I decided to like move to Sierra Leone, because I was like, if Paul Farmer can do it in Haiti,
exactly,
I can do it. And you know, I was so devastated when he passed, but also just like inspired by the fact that the work and the mission continues at PIH. And I know that you guys, not just in Sierra Leone, but even right now, just like really pushing the agenda to safeguard global health and public health in general, not even just on the maternal and child health care. So just wanted to share, like, I'm a huge fan of PIH fan. They know me on your Instagram page. I'm always like, go PIH. I love the work that you're doing. Tell me how you approach, you know, reproductive health education and period poverty, and trying to uplift girls and women in the communities that you serve with the right information and resources. What kind of interventions are you implementing to positively impact the reproductive health, not just like period, but just like the reproductive health of girls and women in general?
Okay, thanks very much for that question, Vicky. It's really great. And reproductive, maternal, newborn, child, adolescent health is a really huge part of the work that PIH does generally, but especially in Sierra Leone here, it is one of our, it's our biggest program. It is what actually, when we talk about preferential health options for the poor, when it comes to our maternal health package, we are really invested in that. And one of the steps that we've taken to ensure that, you continue to address the health needs, not just in the short term, but in a sustainable manner, is investing in building that maternal center of excellence. This was a dream that when we first started it in PIH back in 2017, it was a little building that would fit on those little exercise books that we use in Sierra Leone and you take out the middle page. That was all it was about. Yes. Um, Fast forward to 2018, 2019, Paul Farmer comes along and he was like, you guys need to dream big. If you're calling this a center of excellence, you need to really think about what do you tag as excellence when you're talking about healthcare? What would you expect to see as excellence and excellence standards, not just in Sierra Leone, but if you think about this on a global perspective, where and how do you count excellence? So we put that paper aside and started really thinking through what are the systems and the services that you would need to have in a place like that we don't currently have in Sierra Leone that would really meet and talk to the health needs for women of reproductive age, their sexuality, as well as their overall health, and going on to the children that we're hoping that they would produce or not within this sphere. And so we sat and worked on that again. And I'm really looking forward to having this opening in October and start receiving patients in there starting from January next year. And this is really talking to one, women, yeah, let's start with the adolescents, addressing that issue around sexuality, around trying to figure out who am I and what am I, and not just within a sexual health. So we already have started our adolescents and youth friendly service clinic, which is one of the best within the country. And they're forever talking about this because we're looking at all aspects of what are young people really wanting to know about themselves, for themselves, and can also teaching them to be able to advocate for these rights and needs by starting up youth groups, peer support groups within the schools, so supporting secondary and primary schools within Kono districts to say that, okay, you guys get together, teach them within the using the National Secretariat for Reducing Adolescents Teenage Pregnancy. So they come in, teach these children. We've literally just finished teaching another set of 40 school children to become peer support workers for each other. They have school clubs where we go, somebody from the team will just go and sit in and listen and talk. If there's anything that you feel you need to advise about or they need to ask, there's always somebody there for that. But they're educating themselves. They're talking about sexuality. They're talking about safe sex. They're talking about family planning. They're talking about should I not? Who is this? Who am I? All these sort of things, as well as also talking about things like career guidance. What do you want to do with your life? You cannot just be planning to play all day, every day of your life. I don't who doesn't tolerate that sort of stuff. So what do you want to do? And how are we going to help you to be able to achieve that? And moving on through from there, now going on to reproductive health itself. For those that are having problems and really looking and addressing this issue around sexually transmitted infections, of which there are a lot, and nobody talks about it. All you hear is bad water this, bad water that, boily here, this, that. What are these things? Can you come and let's talk about it and let's see it? And let's have a discussion about what you are going to do to treat this one and what you're not going to do again. So guess what? You don't get the next one. And once you're at it, go and take this message around out there and pass it on as well. And then within the area of maternal health, really again, looking at how can we really improve maternal health outcomes by not just talk, but going out there into the communities, doing a lot of community engagement, having mothers come through and talk about what are the barriers and stigmas that prevent them from accessing healthcare in the first place, and what do they think they need to be able to solve those issues, and then applying that in practice as far as we can, and making our health setting a place where people want to come to, where you're not going to be criticized, where you're not going to be degraded, where you are going to be treated with respect, and where your care, you're going to be consulted about what do you want. How do you want this to happen? And let's try and come to a middle way. Maybe some of what you're expecting is not realistic, but let's work together to come up with a plan that is fit for purpose and that you would like. And not just the women themselves, but a big part of all of this is always involving the partners. Because within all of this fear, we always forget that somewhere we're so busy trying to solve all our women issues that there's a man involved somewhere at the back there. And in our settings, if there is only so much the woman herself or the girl child can be empowered to do, that you come to a point if you have not involved the significant others behind her, as well as if she does have a male partner in that whole care package. Because once she goes home, how is she going to apply that if he is not aware and he does not consent? How can she have family planning if he doesn't even know? Do you know how many mothers we've had? This one is having her ninth child, and you're trying to talk to her about family planning on the day. Wait, Lily Manka. Huh? My dear, you just nearly died, and you're telling me I should wait for your husband to come, but she's not going to take it because she hasn't got that permission, that buy-in, that okay to say, yes, I can go ahead and do that. So how do we address all of those? Include the male partners as well, in as much as you can. And when you're talking about reproductive health, always have the male child, boy, whatever, in that conversation as well, so he can understand things from a male perspective, but also what are women going through, and how am I, as a male child, going to be able to support not just these girls that are in my class, but going further in the future? How can I be a supportive partner for any woman that I then come across once I've reached adulthood?
Thank you so
So
much.
those are some of the things that we're working
Oh,
on. Thank
I
you.
mean, I remember when I saw the news about the Maternal Center of Excellence, and I think I saw like diagrams of it or like architectural designs. And so to be able to have seen the concept and that you guys are going to now be opening your doors in October, that's incredible. In terms of like speed of delivery speed in Sierra Leone for a project, I don't know. It's giving some like extra, like really fast. So congratulations to you guys for being able to like pull that off.
Thank
I
you.
know.
But just as a correction, we're going to start having patients in from January of next year. So October, we'll have the opening ceremony, and then we'll start having our first patients in January. So we're really looking forward to that.
Awesome. Congratulations. Allison, I know you've been on this call kind of quiet, but so I think sometimes it's people don't understand how Schools for Salone works with its partners. So if you can like just like break it down, how is Woman Talk able to operate in Sierra Leone? What kind of support and resources does Schools for Salone provide, and where does the organization get those resources?
Yeah, thanks, Vicki. I just want to also thank everybody on the call because this has been a wonderful conversation. So thank you all for your thoughts. So like Vicki said at the top of the call and our conversation, you know, Schools for Salone is really a philanthropic arm for Women Talk and our 5 partners. So, you know, we always say we do all of our work through our 5 partners on the ground to expand access to quality education in the schools that we've built. 47 of them as of like the end of this month, which will be really exciting. But they all have a really important role in supporting education in these schools. And so for Women Talk, you know, we support all of their operations and administrative costs. So they can be able to do this work in the communities. They can travel to these communities. They can engage with their schools and their school administrators. And so that's really kind of our main role, is to support them, you know, not only in resources and financial resources, but then also as a organization that helps, sometimes I help with tech issues, for example, as a support for them to be able to really operate successfully. As you can see from the videos and from listening to Juliet, they're a very, very passionate group of people. And they do incredible work on the ground. So we really enable them to financially and to give those resources so they can go and engage students in our schools and the schools we support across the country each term. So they go every term throughout the school year and make sure that, you know, kids are getting the education and the information and the resources they need to be healthy and stay in school. So.
Thank you. I mean, when I do these conversations, I like to paint a best case scenario vision, right? if we were able to meet the needs, the reproductive health needs of every young girl in Sierra Leone, where they know about their bodies, how they work, they have the pads that they need. How do you think this will impact or affect their overall well being when they become women?
First of all, it would give them that sense of pride in themselves and knowing that, being a woman is something that you should be proud of. It should be an ingrained sense of dignity about you. They should have that sense of self-worth, that sense of ownership, and that sense that I am who I am, and I am me, and I am worth it. That is what that would ingrain in them. Because currently now, for a lot of them, first of all, starting from um, not being able to manage themselves during their menstrual cycle ends up with one, missing days off from school. Those could be days in which you're missing valuable lessons that you'll never know. These teachers don't go back and teach you that again. So you've missed that, you've missed out on it. It comes to exams time, you're failing that. And then you become a failure by extension because you were not able to go to the next class because you never made the exams, etc., etc. There's no money for you to repeat a class. Oh well, you fool anyway, so you might as well just drop out from school and we'll find something else for you to do. So that's one child's future that has just gone down the drain because one, she's ashamed to go to school during her menstrual cycle. When she does go to school, everybody knows about it because she hasn't got somewhere. Even if you go to some of these schools, I know someone mentioned about 14% or 17% of schools being prepared to support girls with that. That is a very small percentage of the overall schools within Sierra Leone. You would go and you would not even find a toilet that is fit for purpose. You will not find anywhere to dispose of any kind of pad of any, it's just bad. So end up staying at home. Even when they do go to school, even things like they might have menstrual cramps and cannot feel able to talk about it. And in some cases, this can be debilitating. I've got my 17-year-old daughter who, I mean, in the 3 or 4, 5 days of joy cycle, my gosh, we're all scared of her because one, she becomes, oh, we're scared. Her dad will be calling me like, you need to talk to Joy. And I'm like, why? What are you doing there? No, I can't talk to her. Nobody can talk to her. So even children having to cope through that and not their parents and nobody else having an understanding. And you become this person that this one is PTI, this one is rude, this one is untraining, and you're ostracized just because of that. But this is a normal process. Your hormones are out of sync. Nobody understands this. Nobody is there to help you or to know that, for 5 days in the month, Joy, my darling, I love her dearly, is out of control. But we all know this, and we're all counting the days with her with trepidation. And we start now. What can we give Joy to ease her through these 5 days so some of us can have some peace and quiet and she can get through? And on day 6, she's an angel. How many parents know this is coming? And what are you doing to prepare? Yeah, yeah, yeah. I love her. I hope she never listens to this, but that is her. So how do we work on that to ensure that more parents are prepared for this and can help the children through this, and this child doesn't become victimized because of something that is a natural progression of a cycle, and knowing that at some point, early 20s or something, she'll get over it and she'll be fine because she has now learned how to cope with her body. She understands what's happening. She has prepared herself, has taken whatever medication that she needs to take prior, and therefore can get through her cycle easily without this having to impact. And there's so many ways that just being a woman and getting into puberty is impacting on girls' lives. It's not even funny in this place. So we need more education. We need more awareness around this. And again, not just for the girls, for the men folks as well. So that they can also be more supportive, more understanding, more open to this. And in the schools, even having somewhere like a sick room or some paracetamol or just two paracetamol can make a change to someone's life that she can now sit there quietly in the class and be able to cope throughout that day and go home and still be able to carry on with her studies so that girls do not have to literally be dropped out of school or be ostracized just because they're going through their menstrual cycles and cannot don't know as yet how to cope with this because it's a stage.
Right.
It's a stage. You don't just get up it takes time for you to understand this is my body, this is how it works, this is what I need, this is what I don't need, and go through from there.
As you're talking,
Thank you.
as you're talking, I just got a flashback to being in high school and getting my period, and each time going to the nurse's office and the nurse calling my dad and my dad leaving work and coming to take me home and going home for the day. And so it's that like, and there was never any like shame or stigma. It's just that like, yeah, I'm on my period. I can't do class today. I'm going home, and we talk about, right now as women, there's a lot of conversation around soft life, right? Like having a soft life. But, I feel like soft life has to start in girlhood and adolescence, right? And a huge part of that is how the world makes space for us to thrive as young women, as adolescents, right? Like no girl should go to a school that doesn't have running water, right? Because it means that I can't have period dignity. No girl should be in a school where there aren't pads readily available in school to give you for free, right? Because it can happen at any time. Because you might have a kid, but your kid is at home, right? Because you didn't know, you're a girl. You don't know the signs of when you're about to get your period, right? So all schools should have pads to give to girls for free. Thankful, growing up in the US, those are the kinds of resources that we had. So I never had to think about, I need to walk around with a pad all the time, right? Because you know that you can just go to the nurse's office. So this is why, part of the conversation that I had is that this isn't really a question of just being too poor to buy pads. It's about society, girls and women living in a society that's not designed to support us with something as natural as your period. It's like society wants you to just get on with it, but I don't got no resources to get on with it. You've not set up the infrastructure for me to be able to manage my period, which is why this day is so important, because if you don't have running water in my school, if my community doesn't have running water, how can I have menstrual hygiene? It's not possible for me, right? So it's really that society's falling short on providing the resources for girls, adolescents, and women to manage their periods. And which brings me to my next question. For you, Diana, how can, on the national or global level, like how do policymakers need to be thinking about menstrual hygiene and responding to the needs of girls and women to help them manage their periods?
Yeah, that's such a good question, because there's not a lot of policies around that truly exist. And I think part of it, I want to back up, I've been in rooms with, like I'm thinking when I was in Malawi, a government official, when we were talking to him about menstrual health, and he's like, why have I never known this? Like, I don't understand. And then another man was like, please don't leave us out of these conversations. And I said, look, it's not that you've been left out. It's that society has never provided an opportunity where we could really comfortably talk about this. And now we are. And so I always like to say for those that are male leaders, I'd like to think it's maleness, not malice. But once they know, they need to get on board and become an ally. And so the policies that they can put into place are talking about it, recognizing it. I think some of the greatest allies, along with our local leaders, are those government leaders who are men who will step up in a room and say, this is natural, it's normal, and we need to address it. So I think there's many policies that can come about. There's policies to include education, like what Leone was saying, sexual reproductive health, it starts when you're born and it's the entire life cycle. And if people can understand what menstruation is as one part of their whole entire life cycle, it can be a game changer. Boys can, instead of teasing girls at school, they can provide their sweaters to cover up if a girl is soiled. We've seen changes when men understand, and boys, what this is. So I think we need policies that provide for education. We need policies to ensure that there's choice. We shouldn't be telling everybody always what to use. Let them choose and what works best for you. Also have resources to have private, safe spaces to change and manage your menstruation, even if it's at work, at school. And there's so many more. It's education, it's policy, it's the facilities. It's also recognizing that there's atypical period pain. We can't tell everybody just to take a pill and deal with it. Some people really suffer from debilitating menstrual, like endometriosis. And so it's recognizing that there's much more to be needed. And then I will put a plug. We need private sector in the room. For years I've advocated for menstrual health. And I remember one time private sector, quite a large organization, came in and said, now we're interested. And government in that country was like, oh, okay, now we're interested. And so one way is, let's get the private sector to recognize I think a lot of times we tap them to do social corporate responsibility, which is great, but also how are they addressing it within their own workplaces? We started this initiative globally that's called the Period Positive Workplace. I think if you can start within your own house, recognizing the need, then you work out, that will change society. And then just in closing, I think at the basic level, have a conversation. Don't shy away from it. Be age appropriate. And as Leanne said, you can say anything. It's when you say it and how you say it. And so being culturally aware, but getting in there and having these conversations to change it. And we can. I think it's happening. We'd love it to happen more quickly, but we can't change anything if we don't have a conversation about it first.
Thank you so much. Leanne, on the individual or community level or families, maybe there are people who are watching this and say, well, I can't afford a pad, right? Like, it's too much for me. This is all we have is a pieces or a cloth, right? Whether you have the resources to purchase or not, what can individuals and families do to support their daughters and their daughters with managing their periods, and also with understanding what kind of environment do parents need to create at the home level, and what are some of the small changes they can do, right? Like starting from this conversation, to help the girls and women in their life manage their periods better. I mean, ultimately for me, it's about period dignity. How can we ensure that period dignity exists in the household?
I think that's an excellent question. And I think it really starts from exactly where Diana was getting to in terms of having conversation. I think, but in order to have that conversation, you yourself as a parent need to come to terms with your own shame, with your own, with your own insecurities about your body, with your own insecurities about your period, about the traumas that you experienced with your period, and also understanding that if you don't do something to break the cycle and the silence, it's going to happen to your daughter. And is that what you want? You know what I'm saying? And I think if you ask any mother, they're going to say, no, that's not what I want. Mm-hmm. So what are the things that we can do to start to break the cycle of silence, the cycle of shame, right? Mm-hmm. And I think that this is where we really have to try and to empower our parents, our young mothers, to really try and to break that silence, which can be difficult. But I think ultimately, if we had a space where parents can become that trusted, knowledgeable adult, that's really where it starts for the conversation to open up. Just to even just share your story. When my first period story, everybody got a first period story. This is how kids will be like, what? That happened to you? And, it's just one of those things that I think is classic, and I call it like a teachable moment. There's teachable moments every day And it doesn't have to be like go hard, deep, pull out a diagram type of situation. It can just be that you're watching a little Nigerian film, which they all be watching anyway, and they're starting to kiss and stuff, and be like, pause. What do you see happening there? You know, you look a little uncomfortable. Why do you want to leave? Don't leave. Come back. What's happening there? What do you understand that's happening? I mean, obviously it doesn't have to be that deep, but I'm saying that there are little teachable moments that can happen throughout the day. You could be on your period as a mother and invite your daughter to come in. That's what my mama did. My mom, my mom would be changing her pad and be like, come in here, and I'd be like, and she's like, I was like, is that a diaper? She's like, yeah, it's a lady diaper. And she would, and so these are the things. I mean, that's how you make things not so scary.
Right.
That's just how you make things not so scary. It just really starts by little teachable moments, and every parent is equipped to do that in their own way.
Thank you. Thank you so much. We're just wrapping up the conversation. First of all, there are 184 people watching this conversation about period poverty and menstrual hygiene, which is like really impressive. Like, do you know how hard it is to keep people on live? So I don't know where all these people came from, but I'm really, really glad that you've stayed for the conversation. It shows that there is so much value in having these conversations and talking about these issues, because people are interested, and people also people are going through things, right? And we're all looking for ways to manage these issues. Juliet, I want to close the conversation with you. Woman Talk has been doing this work for 5 years. You will continue to do this work. What do you really need right now? To the people who are watching this, who are saying, hey, we love what you do and we want to support your work. What is that work? What do you need to get done now that if you had more resources, you would be able to do that work at Women Talk? I don't know if you can hear me. Can you hear me, Juliet? I don't think so.
Oh.
Did you hear what I said, Juliet? Sorry. Hello?
Come again. Do you hear me?
Sorry.
Yeah.
Okay.
Do you hear me?
Yes, I can hear
Come
you.
again.
Yes, I can hear you. Yeah. So what I was asking is, there are a lot of people who are watching this conversation today, and they would be interested in, they want to know how will their support help the work that Women Talk is doing beyond today? What would the support help Women Talk do over the next year, at least? If people were to make donations today to support the reproductive health education or the manufacturer path, how would this advance your mission to expand access to menstrual hygiene across Sierra Leone?
I'm not able to forget.
I can hear you. Hello?
Hello? Yeah. I couldn't hear you clearly.
Okay. So what I was asking was, if you were to get support today, what would it help Women Talk do? If people were to donate to this campaign today, what would it help you do in the next year? Okay. Juliet, since you may not be able to hear me, Allison, I know that you have like Women Talks program for the next, I know you have the like program plans. Could you speak a little bit about the year ahead? If Women Talk was to get support today, for people who are wondering how to support this work, what would it help the organization accomplish beyond where they are now?
Right. So, one thing I think that's been talked about a lot today, and I'm so glad that Leanne and Isata and Diana, we've all kind of brought this up, is this engagement with parents. And this has been something we've really kind of scaled up in this last academic year. And the Women Talk team has been, doing really great job and, starting to engage parents in the community. But I think, it's it needs to be ongoing conversations. So this is something that we want to continue to scale, over the next, next academic year, as well as obviously continuing to engage our students in our schools. Another thing we've been thinking about, and again, it was just being referenced quite a lot, is, really assessing what our latrine and our wash facilities look like at all our schools. So this is something we need to kind of look at and really do an assessment. Things get broken, things need to be updated. So this is another thing we really want to do over the next year, is really do a full assessment on, where do we have needs in terms of wash and in terms of good sanitation at our schools as well. I know that, Julia and the team really want to continue and to support their workshop and to continue to manufacture pads and distribute pads, across Sierra Leone and partner with other organizations as well. So, after 20 years at Schools for Salone and 5 years of Talk, we really are going to take some time in the next few months to really assess what's working well and what are the challenges, and come up with some new plans for the next kind of chapter. So.
All right. Thank you so much. Thank you, everyone, for joining.
I can come in and say more.
Please go ahead and say
yes.
Yes.
Please go ahead.
So everyone in this room has a role to play. We want people to talk about periods, normalize the conversation at home, at school, and in public. Support organizations like Women Talk through partnership, donations, or volunteering. Engage your community. Involve men and women, young and old, in understanding and supporting menstrual health. Then advocate for change. Push for menstrual products to be included in schools and health budgets, and for menstrual health education to be part of the school curriculum. And we want everybody, menstrual health should be part of everybody's business. And just a contribution of $11 can keep a girl in school for more than 3 years. So we are advocating for everybody to come on board and do this for us. Why? Because no nation can soar if only one of its population is free. So our efforts will improve lives and help to reverse of our focus empowering girls, women, community, and nations. And in doing so, our Sierra Leone. So it is like all of us working together to end the epidemic of silence and lack of quality, sustainable solution. So you are all a vital part of this solution. We need your support. Come on board. Help girls, help women, especially those in the provinces, those in the remote areas. They need you. People are suffering for those simple hygiene products. So we need your contributions to help. We are here, we are ready to go out to deliver to those people. But then we need your support. Schools for Salone is doing it greatly, but we want all of you to come on board and help so that period will no longer be a problem. Will no longer be a problem. And thank you for seeing that. So
Together, we will all reach every guy, every woman, every period. When you all come together. Thank you.
Thank you, Juliet. Thank you so much. Thank you very much. And to the rest of our guests, does anyone have any last words? Thank you so much for joining us. If you have any last words, please, take the floor. Otherwise, thank you so much, ladies. This has been a fantastic conversation. I wish we could do this all the time. But thank you so much for making time out of your schedules for this national conversation, global conversation about the need for menstrual hygiene support and reproductive health education. Thank you, ladies. And to our audience, don't go anywhere. The show is still here. I'm still here. Don't go, don't go anywhere. So, thank you, ladies. So today, we wanted to have this conversation to highlight the need for menstrual hygiene support by way of resources and reproductive health. One thing that we know from working in Sierra Leone over 2 decades as Schools for Salone is that if you want to expand access to quality education, you have to strengthen the ecosystem to do so. It means you have to build schools, you have to train teachers, you have to work on literacy, and also you have to work on equity. You have to remove the barriers that make it difficult or impossible for girls to access quality education. And that's where Woman Talk comes in, because what we've learned is that when a girl doesn't have the education about her body, how it works, reproduction, her reproductive health, she can't manage her period. When a girl doesn't have a pad or pads for her period, she can't manage her period. And ultimately, that doesn't just affect her quality of life, it affects her education. If a girl is missing 3-4 days of school every single month, or even just 2 or 3 days of school monthly in a school year, that's going to affect her education. And our ultimate goal is to make sure boys and girls complete their secondary school education, meeting their learning outcomes, can read, can write, can do arithmetic. But if girls have to stay at home because they don't have the resources to manage a period, it affects their overall educational performance. So what we're asking for here today is for you to support our work to advance girls' health and education in Sierra Leone. Schools for Salone has been supporting Woman Talk for the last 5 years. In fact, the organization's Woman Talk came into existence because Schools for Salone was responding to the immediate need in the post-Ebola period. And what we really want to do is to continue to support women like Juliet and the team in Freetown who are making these pads and going into communities to educate and empower girls, boys, and their families to help girls manage their periods. We're giving the kits, which are provided to us, the materials are provided to us, are patented, provided to us through Days for Girls International. So we know that it's hygienic, it's sustainable, and it is available, right? So we're manufacturing them locally. And then we distribute at Schools for Salone has 47 schools that it supports, whether it's through teacher training, books, et cetera, et cetera. It is in those schools that we also distribute these pads. So every school year we go in, girls who don't have pads, we provide it to them. We educate them about how to use their bodies. Our goal is to raise $15,000 for this year's campaign. We've raised about $2,218 so far. If you're watching and you would like to support our work, please head to, let me see if I can get, no, is that what I wanted? I want to share a window. Let's see if I can do that again. I want to share a window. Stop sharing screen. I want to share a window to our website. Hopefully it will do that for me. Is it going to do that for me? No, it's not going to do that for me. Instead, it's going to show me the wrong window. Why is it doing that? I'm going to try one more time. No, that just made it worse. Okay, so I think you can see my window. So this is our menstrual hygiene campaign. And throughout May, which is just for the next couple days, we're trying to raise funds to support Women Talk's work in Sierra Leone. It means that the more pads we get, the more kits we can make, and more we can continue to provide reproductive health education across the schools, and also support organizations who do come to us and want to partner to do this work. I'm just going to stop sharing my screen because this is ugly. It's very, very ugly. So to support our work, you can go to our website, schoolsforsalone.org, click donate. But to support this particular campaign, the website to donate is on a banner here. Yeah, this is not the smartest way to do this. I'm usually very smart in all things, but today, technologically challenged. You guys will have to forgive me this one time of technological challenge. So yeah, if you would like to donate, you can see this URL on the screen, which is, we've created a short link, shorturl.atke. You see it. I'm not going to say it. We're also, for those of you who registered to see this webinar, we're going to be sending around an email which will have the link to donate. You can also copy this link here to make a gift today. So if you just go into the comments and just copy this and paste it into your browser, you'll be able to make a donation. Also, you can reach out to me or message Schools for Salone on any of our social media platforms. We're on LinkedIn, Facebook, and also Instagram. If you also go to our website, which I highly recommend that you do, please subscribe to our newsletter, because I send out amazing monthly updates, really beautiful newsletters every single month to keep our supporters connected to the work that we're doing in Sierra Leone, and to also just follow, you know, leaders like Juliet and some of our other partners who are helping to strengthen the ecosystem to deliver quality education in Sierra Leone. I want to thank all of my speakers today: Juliet Roman, the Executive Director at Women Talk; Leanne Riss, Country Director of the Mama Pekin Foundation; Aissata Dunbuya, Director of Maternal and Reproductive Health at PIH; and Diana Nelson, Global Advocacy Director at Days for Girls International; and of course, Allison Sinning, Executive Director of Schools for Salone. Thank you so much. I really appreciate all of your comments. Thank you for making the time. We know that this was long, but yes, please support our work to expand access to menstrual hygiene kits and reproductive health education in Sierra Leone. Again, you can find Schools for Salone across all social media platforms, but most importantly, you can find us on our website at schoolsforsalone.org, where you can subscribe to our newsletter and donate to our work. Thank you so much. Have a great day.